Let me go through one here, which is the matter of health. And this one I see has been causing a bit of stir and discussion, and rightly so. And so I want to update the country on where we met it and what we have done. One thing I always try to do, even though I would speak about health, I would speak about it from a policy standpoint and not get into this back and forth of the smaller things. But for example, the blood bank. For years, people could not go after hours and people could not go on weekends. We had to change that. And we are changing that and have changed the policy within this first 6 months. A serious policy like that. However, with every new policy, it takes a time to become culture and fully integrated into the system. So it means, therefore, there will be periods when there might be a little ups and downs here, but can be easily corrected when approached. That had been an issue to the point where we had blood bank drive, and we're going to be encouraging people to donate blood regularly and so forth, so that that can be had. So we were able to put the policies in place to deal specifically with that, and we are going to expand the time of blood products that we will offer as well. That policy had to change, and we changed it just within the 6 months, 6 to 7 months. With respect also to Pogson Hospital, we have sought to increase the doctor coverage in Pogson Hospital. You live at Pogson, and you know at certain times you couldn't get a doctor at all. And we are now transitioning to get doctors at Pogson to have full coverage. And what we are moving to is to establish the X-ray department there and to establish a lab. And even if it is at point care in terms of lab tests to be done there. And so we are in the process of doing that. For years, I don't think that was ever offered. An X-ray was never offered in Pogson. Because when I went to see the X-ray room, the X-ray machine is new, but it was never used. Well, it was new, but it had never been used. And therefore, it will need some refurbishing and to be used for the first time so that the people of Sandy Point and the surroundings can get extended care. And what we recognize is that the people from Sandy Point are happy that when they go to Pogson, they find a doctor. And so we are stabilizing that. We have more doctors covering there, but we want to get it up to a full-time, steady, 24-hour type of service. So we are proud of that. That had never been attempted at that before, and we are doing that within the first 6 months.